So from your personal statement, I see you spent some time in general practice. Can you tell me a bit more about this experience?
So I spent 2 weeks at Rush Green Medical Centre to try and find out a bit more about how primary care works. So during my afternoons I worked on an audit, and my mornings were spent sitting in on consultations. And this really allowed me to see how important good communication skills are to establishing a solid doctor-patient rapport. So one particular patient I saw was a female in her mid-20s who came in asking about contraceptive advice. And from the onset of the consultation, the patient's ideas were clear. She wanted to go on to the combined oral contraceptive pill. But during the history, the GP found that the patient had actually had a single episode 6 years ago of a migraine with aura, so visual disturbances, and this is one of the big contraindications for using the pill. But the patient was unaware that this was a problem and actually insisted that she had previously been on one of the combined oral contraceptives. I think it was called Yasmin. So the GP checked her past prescriptions and found she had been prescribed Yasmin, and immediately admitted that this was a mistake by one of her colleagues. So within the next 10 minutes, the GP managed to explain to the patient the significantly increased risk of stroke that she was at if she used the combined pill due to a history of migraine with aura, reassured the patient the mistake wouldn't happen again, and offered the patient alternative methods of contraception such as barrier contraception. And the patient left both happy and better informed of the situation. So overall, this particular consultation really showed me how important starting with an open question is, listening to the patient, allowing them to tell their story, and then following up on any red flag symptoms with more closed questioning, while always trying to work with the patient to come up with a management plan that suits them. And all of this contributes to establishing that really solid doctor-patient rapport.
Tell me about your work experience is a really common question, so make sure you prepare for it well and really impress your interviewer. They might throw it to you as a very general question, such as, tell me your work experience, or something more specific, like what I got asked. Tell me about your work experience in general practice. Always use the Easy Medical Interviews framework for a work experience question. There's 3 steps to it. Firstly, key details about your work experience, then one example case, and then what you learned from your work experience. And the main thing the interviewer is interested in is number 3, so what you learned from your experience. So in my particular answer that I gave, I started off with the key details. Which practice I was at, Rush Green Medical Centre, how long, 2 weeks, and what I spent there, how I spent my time there. So in the afternoons I worked on an audit, in the mornings I sat in on consultations. Then I went to my example case, and I've used a very bog standard case of contraceptive advice. Your case doesn't have to be super interesting if you didn't have one, if you didn't see anything that was that interesting. They're mainly interested in your learning points. And I've gone for communication, which is an interviewer's favourite. And if you do choose communication, make sure you use the buzzwords open to closed questioning, listening, and red flag symptoms. There are loads of different learning points that you can go with. Some of the ones I recommend, obviously communication. The others include holistic medicine, patient-centered approach, and multidisciplinary team, although that one's more relevant in a hospital setting.